Hey, it's Dr. Wells here, and I often get the question, why do I even need to treat my obstructive sleep apnea? So I want to go through that a little bit in the next few minutes. So the severity of your sleep apnea should inform your treatment decision. In other words, if you have moderate sleep apnea or severe sleep apnea, I can tell you with a great deal of confidence that even if you are not experiencing daytime sleepiness or perceiving sleep disruption, the presence of moderate to severe obstructive sleep apnea will impact your long-term health and your risk for conditions like heart disease, high blood pressure, diabetes, weight gain, stroke, mental health conditions, and on and on. So people with moderate to severe obstructive sleep apnea need to get that treated, even if they're asymptomatic, even if they don't feel like they're sleepy during the daytime. We don't understand the correlation between sleep apnea and sleepiness very well yet. Just rest assured that your sleep is being disrupted, your oxygen levels are going down, and this is a problem. For people who have mild sleep apnea, it's more dependent on the circumstances that you have personally. For example, if someone is telling me that they're very sleepy during the day, then yes, I would recommend that they treat their mild sleep apnea. If someone has just had a heart attack or a stroke, or they can't get their diabetes under control, or they've got prediabetes and they want to back out of that pre-diabetic state, then yes, I would recommend that mild sleep apnea be treated. If a sleep test was done for some reason other than a health concern or symptoms, and it shows mild sleep apnea, then I would want to look at the limitations, especially if you did a home sleep apnea test, which has a tendency to underestimate the severity of sleep apnea. So a little bit of nuance is in order if you've done a home sleep test and it's in the mild range. I want to point out that sleep is a state of unconsciousness. And so if you kind of overlay what happens with sleep apnea to the daytime, let's pretend you were working at your computer and all of a sudden you had an airway blockage that prevented you from pulling air into your lungs effectively. Your blood oxygen level dropped and your concentration got thrown off. You had to stop what you were doing in order to take a breath and recover your blood oxygen level. If that happened to you repeatedly during the daytime, 15 times an hour, 20, 30, 40 times an hour, you would be in the emergency room trying to get that figured out right away. Well, at night, this is what's happening. And sleep is critical to your brain health, your heart health, and your metabolic health. So don't let this go untreated. Don't let your sleep apnea go undertreated by not treating it throughout the whole night. This is really important. And I want you guys to shoot for fully treated sleep apnea throughout the entire night as a lifestyle factor, as a lifestyle practice, so that you can be as healthy as possible.